We are so pleased to share, as part of the Canadian Association on Gerontology 2023 conference program, some of the capacity building opportunities for patient-oriented research on aging that we've co-created with trainees, researchers, and older adults at the McMaster Collaborative for Health and Aging. I'm Soo Chan Carusone, and you'll also be hearing from Cassandra D'Amore. But we want to recognize the amazing team of older adult partners from the collaborative who contributed to this work every step of the way, and you can see them here named as our co-authors. Thank you also to our funders who support this work. First of all, who are we? The McMaster Collaborative for Health and Aging is a coalition of researchers, trainees, older adults, and caregivers working together to improve the health and well-being of older Canadians by advancing patient-oriented health research on aging. How do we do this? We strive to achieve this by providing consultations and supports, through training and mentorship, and by facilitating partnerships and knowledge translation across experience and disciplines. This is an image of our organizational structure, which you can find on our website. I have it here because central to everything we do is our three primary membership groups: our older adult and caregiver partners, researchers, and trainees. Not only are there collaborative members from each of these groups, but we strive to create an environment where our partners, researchers, and trainees can collaborate on everything we do. The image on the right here is a photo that one of our partners took to represent what she sees as ideal partnership. The beautiful and vibrant knitted sample demonstrates, as she says, the impact of having older adults engaged in all aspects of research, where our voices and lived experiences help researchers and policymakers weave a cohesive path to an effective healthcare system. As we work together at the collaborative to champion this, we strive to do our work with this approach of weaving our respective wisdom to both identify and move along our paths. In this presentation, we provide a few examples of tools and supports that we've developed to build capacity for patient-oriented research and aging, all of which were developed and operate in partnership. We have QR codes on the slides where you can access these tools and supports. And if you're interested in learning more about our co-development process, I encourage you to reach out. Our first tool is a Partnering Principles and Strategies guidance document, which was first created for our own members, so we were approaching partnership with older adults and caregivers with the same common principles and language, but also to encourage some consistency in activities and considerations that embody these principles, specifically for the steps of recruitment, orientation, and meetings with older adults and caregivers. For example, the importance of having individual conversations during the orientation process with new partners to discuss their preferences for communication, be it phone or email, and their timing and frequency preference for reminders. What's their comfort with technology? Do they have a device and internet access? Are they comfortable with platforms such as Zoom? And what supports might they need for an in-person meetings? For example, respite or attendant care or accessible transportation. I'm going to turn it over now to Cassandra, a collaborative trainee who I've had the pleasure of working with for a couple of years now, and she's going to talk about some examples of where we built from this guidance document and principles to more specific supports and tools for trainees.
Thank you, Sue. As Sue mentioned, my name is Cassandra. I'm a PhD candidate in the School of Rehabilitation Science at McMaster University. I'm now going to introduce a couple of trainee-specific supports created by the collaborative and speak to some personal experiences from myself as well as other trainees and older adult partners from the collaborative. On the screen is the Partnership in Research Fellowship, renamed from the Trainee Engagement Fund to better reflect the goals and priorities of this opportunity, which is partnership in research. The overall aim of the fellowship is to provide opportunities for trainees to learn and gain experience in partnered work in a meaningful and safe manner. This fellowship helps alleviate barriers to engagement work by providing financial as well as experiential support throughout the trainee's proposed work. No previous experience by the trainee or their supervisor in engaging older adult or caregivers is required. Trainees from any discipline or faculty with research focused on aging are encouraged to apply. Successful applicants have the opportunity to receive feedback on their plans and methods from researchers with experience in these methods, as well as older adult partners and caregiver partners from the collaborative. To date, the fellowship has gone through 3 rounds of applications and is currently funding 6 trainees in completing engagement work. As Sue previously mentioned, all 3 member groups of the collaborative are pivotal to its success and are involved in everything we do. For the fellowship, the older adult and caregiver partners were involved right from the idea phase of the initiative, informing its design and now acting as reviewers on the application review team and mentors and advisors for all trainees, meeting with them individually. The partners have really enjoyed their experience through the trainee fellowship program. They've had the opportunity to learn about aging research at the ground level and have given the trainees the opportunity to learn from their experiences. They have provided the support for trainees to modify their plans based on their experience and to empower the trainees as they go forward. Tina says that, as an advisor, I add my voice and experience, challenging trainees to better reflect our needs in research. Mike builds on this, emphasizing how he takes his responsibilities as a reviewer and advisor to these trainees. He believes that my story is one, but there are many more. I feel the responsibility to be an advocate for all those stories to be heard. The Trainee Fellowship provides experiences for trainees that can go beyond their specific projects and even engagement activities. Kenny and I were part of the first round of successful applicants to the fellowship. Trainees come from a variety of backgrounds with many different projects. For example, Kenny is completing a systematic review, whereas I'm completing a quantitative analysis using a very large cohort study. Here we can see Kenny highlighting some of the most valuable aspects and benefits of being a part of the fellowship. He believes that this environment has helped me better understand and be conscious of researcher biases, tokenism, and meaningful collaboration in many settings. The opportunity to engage with collaborative partners while designing and carrying out our engagement plans has been an invaluable opportunity. Echoing Kenny's experience, through discussions with other trainee members, collaborative partners, and researchers, my awareness of the potential harms we as researchers can cause in simple actions and the language we choose has grown substantially. Which leads me to highlight the next resource created by a team of trainees, older adult and caregiver partners, and researchers to guide trainees in the planning and conducting engagement activities. The creation of this workbook was really a team effort, and it went through many rounds of feedback. The experiences from all 3 member groups were used to provide questions and propose reflections that may be helpful for those interested in engaging individuals with relevant lived experiences to inform research. However, the workbook was designed for research trainees who are planning to engage older adults in time-limited activities, for example, 1 or 2 meetings, to inform or advise on their project as a starting point for community-engaged research. It is available for free for anyone to download from the collaborative website as a modifiable Word document, so users can edit and comment in any way. The workbook was provided to fellowship recipients as a tool to planning their meetings with collaborative partners, and it was based on feedback from trainees that we created an even more specific and applicable tool. Our meeting planner template is now also available on the website as a modifiable document. It is a companion piece to the workbook that follows along with its sections to help trainees apply the ideas and core principles discussed to the planning and facilitating of their actual meetings. It provides sections for planning, recording, and reflection that can be used to keep records of engagement activities in a useful way. Hopefully, Sue and I have demonstrated the value of bringing multiple voices to the table at all stages of research and training. As we mentioned, all of our online resources are free to anyone, and we're open to questions or feedback on these resources. The McMaster Collaborative for Health and Aging prides itself on walking the walk, not just talking the talk, and we're happy to share our experiences in designing and building supports if anyone is interested in the idea of creating similar opportunities. We'd like to give one last thank you to our supporters and all the members of our team, without which none of this would be possible. So thank you all.